The poison isn't just in the air anymore. It is inside the food, and you cannot wash it off. In April 2026, scientists confirmed what many had feared was coming. The toxic dust blowing off the dry bed of the Great Salt Lake, a dust laced with arsenic and uranium, was being absorbed directly into the roots of backyard vegetables. Leafy greens, grown in community gardens across the Salt Lake Valley, now contained heavy metals that no amount of scrubbing in the kitchen sink could remove. It was a contamination that had become part of the plant itself. This is happening right now, in and around a major American metropolitan area of 2.66 million people. So how is this not the biggest environmental story in the country? Let me know what you think in the comments below. We cover critical stories like this, the ones that often get ignored until it's too late. A surprising number of people who find these videos valuable forget to subscribe. If you think this kind of reporting is important, please take 1 second to click that button. It makes a huge difference in our ability to get these stories seen. Now, let's begin. This is a crisis that was never supposed to happen. It is also a crisis that was entirely predictable. The Great Salt Lake, the largest saltwater lake in the Western Hemisphere, is a terminal basin. Water flows in from 3 main rivers, the Bear, the Weber, and the Jordan, but it has no outlet to the ocean. For millions of years, the only way water left was through evaporation, leaving behind a concentrated slurry of salts and minerals. A natural system, in a delicate balance. For the last 160 years, that balance has been systematically broken. The rivers that feed the lake have been diverted, siphoned off to water-sprawling suburbs, and, most critically, to irrigate immense fields of agriculture, primarily alfalfa. The city grew, the farms expanded, and the lake was slowly starved. The numbers tell a story of quiet catastrophe. The lake's historical average surface area was roughly 1,700 square miles, a vast inland sea. By November of 2022, after years of record drought and decades of overconsumption, that number had been cut in half. The lake's surface elevation hit an all-time low of 4,188.5 feet, exposing over 800 square miles of dry lakebed. An area larger than the city of Houston turned to dust. This isn't just sand. For over a century, that lake acted as a vault. Every pollutant from upstream mining operations, every chemical from agricultural runoff, every heavy metal discharged in wastewater settled at the bottom, trapped safely beneath a deep, dense layer of salty brine. Lead, mercury, copper, zinc, uranium, and arsenic. Once the water receded, that toxic vault was open to the wind. The exposed lakebed, a dry playa, formed a fragile crust, but wind and weather easily break that crust, lifting microscopic particles, what scientists call PM10, into the air. Particles small enough to bypass the body's natural defenses and travel deep into the lungs, directly into the bloodstream. And they blow straight into the path of 2.66 million people living along the Wasatch Front, a metropolitan corridor that contains over 75% of Utah's entire population. The cities of Salt Lake, Farmington, and West Valley City are on the immediate front line. The first alarms were not subtle. Dr. Kevin Perry, an atmospheric scientist at the University of Utah, spent 2 years conducting one of the most grueling studies imaginable. He drove a bicycle, pulling a trailer of scientific instruments, crisscrossing the desolate, 800-square-mile expanse of the exposed lakebed. He systematically took soil samples from every corner of the playa. The results were not just bad, they were uniformly terrifying. Every single sample he took of the arsenic concentration measured at least 10 times higher than the safety recommendations set by the U.S. Environmental Protection Agency. Not in 1 or 2 hotspots, everywhere. 10 times the level deemed safe for human exposure, spread across an area the size of a modern megacity. It was a warning, a clear signal that the dust wasn't just a nuisance. It was a public health menace, on a scale that was difficult to comprehend. The poison was loose, and for a city that prides itself on clean living and outdoor recreation, it was an uncomfortable, inconvenient truth, a truth that was about to get much, much worse. The initial fear was focused on the air. Salt Lake City already suffers from some of the worst winter air quality in the nation, often worse than Los Angeles. A phenomenon known as an inversion traps pollution in the valley, creating a thick, soupy smog that can last for weeks. Dr. Cassandra Gaston, an atmospheric chemist, began connecting the dots. Her research showed that the dust from the lake wasn't just adding more particulates to the mix. The heavy metals in the dust were acting as catalysts, exacerbating the chemical reactions that create the city's dangerous wintertime ozone pollution. The dying lake was actively making the city's bad air even more toxic. Then came the second wave of research. A study published in September 2024 took the threat from theoretical to biological. It found that the aerosolized sediments from the Great Salt Lake were not just present in the air, they were what scientists call highly bioavailable. This is a critical distinction. Bioavailability measures how easily a substance is absorbed into a living organism's system. Some heavy metals might pass through the body with minimal impact, but the dust from the Great Salt Lake was different. The specific combination of transition metals, manganese, iron, copper, were found to be highly reactive once inside the human body. Dr. Carrie Kelly, a professor of chemical engineering at the University of Utah, led the research. Her findings offered a chilling aha moment for pulmonologists. The metals were triggering precisely the kind of inflammatory lung responses associated with conditions like asthma. The dust wasn't just an inert particle, it was an active chemical irritant. It was a direct line from the dry lakebed to the rising rates of respiratory illness in the valley. You're talking about a very large dust source located next to a very large population, Dr. Kelly explained, and you've got elevated levels of manganese, iron, copper, and lead. Lead is a concern for developmental reasons. Anybody with children understood the implication immediately. The ahistorical average, a number on a chart, had become a real and present danger to their family's health. The state could no longer pretend this was a future problem. The evidence was in the air, in the hospitals, and in the lungs of its citizens. The local government's response tells the story of a system already overwhelmed. By December 2025, the Salt Lake County Health Department wasn't just issuing air quality warnings. It was rolling out emergency mitigation programs. They began offering free asthma home visits, sending specialists into people's houses to help them seal their homes against the air outside. They expanded their lead poisoning prevention program, directly acknowledging the neurotoxins being carried on the wind. These are not the actions of a government managing a minor environmental issue. These are the last-ditch, reactive measures of a city that has lost control of its own environment. When the government is sending medical teams to your house, because the air itself is no longer safe to breathe, you are no longer dealing with a problem. You are living in a crisis. Dr. Benjamin Abbott, a professor of ecosystem ecology at BYU and one of the most vocal advocates for the lake, put it in the starkest terms possible. Anybody with lungs is vulnerable, he stated at a community dust forum in 2025. Anybody with a heart or a brain or reproductive organs is vulnerable. We're all in this together. But what does it mean to be in this together when the very ground beneath your feet is turning against you? The question isn't just about the air. The question is how far the poison can spread. The answer would arrive in the spring of 2026, and it was far worse than anyone had imagined. The scientists who have watched this unfold are not prone to hyperbole. Their work is peer-reviewed, methodical, and cautious, which is why their warnings carry so much weight. They have seen this story play out before. The most terrifying comparison is to the Aral Sea, once the fourth largest lake in the world, located on the border of Kazakhstan and Uzbekistan. But in the 1960s, the Soviet Union diverted the rivers that fed it to create a massive cotton industry in the desert. The plan worked, the cotton grew, and the Aral Sea died. As it vanished, it exposed a toxic lakebed contaminated with decades of agricultural chemicals and industrial waste. The resulting dust storms created a public health catastrophe. Local populations saw skyrocketing rates of respiratory disease, kidney failure, and certain types of cancer. It became one of the planet's worst ecological disasters, a man-made desert where a vibrant sea once existed. Scientists now look at the Great Salt Lake and see the Aral Sea's ghost, a bustling, modern, wealthy American metropolis of over 2.5 million people, walking knowingly into the exact same ecological trap. They see the same water diversions, the same political inaction, the same shrinking shoreline. The key difference? The population living directly downwind of the Great Salt Lake is vastly larger than the one that surrounded the Aral Sea. The other parallel is closer to home. Owens Lake in California. Once a significant body of water, it was drained completely by the 1920s, to provide water for Los Angeles. The result was the single largest source of dust pollution in the United States. For decades, toxic dust storms plagued the region until Los Angeles was forced to spend over $2 billion on mitigation efforts, a price tag that continues to climb. Utah is staring at the same future, a multi-billion-dollar cleanup for a disaster that could have been prevented. But the problem here is even more complex and more insidious. The dust from the Great Salt Lake isn't just a health hazard. It is part of a terrifying feedback loop that is accelerating the very crisis that creates it. It works like this. The dark, metal-laden dust blows from the dry lakebed and settles on the pristine white snowpack of the Wasatch Mountains. Those mountains are the primary water source for the whole region. The snowpack is a natural reservoir, storing winter precipitation and releasing it slowly in the spring and summer to replenish rivers and streams. But the dark dust changes the equation. It lowers the snow's albedo, its ability to reflect sunlight. The darker, dust-covered snow absorbs more solar radiation. It melts faster, and it melts earlier in the season. This premature runoff rushes downstream before it's needed, shortening the growing season for farmers and, critically, reducing the amount of water that actually makes it back into the Great Salt Lake. Less water reaches the lake. The lake shrinks further. More toxic lakebed is exposed. More dark dust is created. That dust blows onto the mountains, which melts the snow even faster. It is a death spiral, a self-perpetuating cycle where the symptom of the disease actively makes the disease worse. The lake is, in effect, killing itself. And it's taking the region's water supply with it. The state of Utah did not simply stand by and watch the lake disappear, not entirely. Confronted with apocalyptic warnings from scientists, the legislature began to act. A flurry of conservation bills were passed. Water-saving measures were implemented. Between 2021 and 2025, a coalition of state agencies, researchers, and water managers, known as the Great Salt Lake Strike Team, managed to deliver nearly 400,000 acre-feet of conserved water back to the lake. That's over 130 billion gallons, a genuinely significant achievement. It should have been enough to turn the tide. It was not enough. In January of 2026, the strike team released its annual summary. The data was sobering. Despite the record conservation efforts, the 2025 water year ended with the lake at an elevation of 4,191.1 feet. It had risen slightly from its 2022 nadir, thanks to a healthy snowpack, but it was still the third lowest level recorded in over 120 years, and it remained nearly 7 feet below 4,198 feet, the absolute minimum elevation scientists believe is necessary for the lake ecosystem to survive. The state had thrown every conservation tool it had at the problem. They had optimized, conserved, and legislated, and they were still losing. The report revealed that historical estimates of urban water use had been too low. The real depletion from cities was 13.7% higher than previously thought. The primary culprit? Residential lawn watering, which drives a staggering 61% of all municipal water use. Amidst the grim data was one small flicker of good news. Engineers had successfully stabilized the salinity in the lake's south arm by raising a physical barrier on the railroad causeway that bisects the lake. This prevented hypersaline water from the north arm from flowing south and destroying the brine shrimp population, a keystone species in the lake's food web. It was a brilliant piece of adaptive management, a crucial, necessary step. But it was like performing CPR on a patient who was still bleeding out. They had saved one part of the ecosystem, for now, but they hadn't solved the fundamental problem. The lake was still being starved of 800,000 acre-feet of water every single year. The fact that this lake is draining should be a wake-up call for the entire region. We've presented the data and the warnings from top scientists, so why isn't more being done? I'm genuinely curious what you think the biggest political or economic obstacle is. Let us know in the comments. Just as the state was grappling with the fact that its conservation efforts weren't enough, the ground shifted again. A new study, published in April 2026, changed the nature of the threat completely. It took the crisis out of the air and put it on the dinner plate. The research was a joint effort between Utah State University and the University of Utah, led by scientists like Dr. Janice Bronny, and executed by graduate students like Molly Blakowski. They wanted to answer a terrifying question. Was the toxic dust settling on Utah's farms and gardens getting into the food supply? They set up experiments, growing leafy vegetables in soil exposed to Great Salt Lake dust. What they found confirmed their worst fears. The plants were taking up heavy metals, including arsenic and uranium, directly through their root systems. The toxins were becoming part of the plant's biology. The team then washed the vegetables thoroughly, simulating what any family would do before preparing a meal. It made no difference. The metals were still there, inside the tissue of the leaves. The implication was staggering. For the hundreds of thousands of people with backyard gardens, for the 40 community gardens located in the 3 most impacted counties, the simple, healthy act of growing and eating your own food had become a potential route for toxic exposure. Over 1/3 of the exposure scenarios modeled in the study showed that eating these vegetables would result in children surpassing the established safety levels for these heavy metals. Dr. Brani summarized the breakthrough with harrowing clarity. Dust is an acute health hazard, she said, but rarely measured for composition or bioavailability. This new research takes our understanding one step further, measuring how toxic-laden dust could infiltrate Utahns' lives in pervasive ways. Pervasive. It was no longer just about the air you breathe on a windy day. It was about the soil in your backyard, the salad you feed your family. The invisible poison had found a new pathway, a pathway that led directly into the human body. If you have family or friends in Utah, or know anyone living through a similar water crisis, please consider sharing this video with them. Raising awareness is the first step, and hitting the like button helps the algorithm show this report to more people who need to see it. It really helps. With this new information, the entire calculus of the crisis has changed. The threat is no longer abstract or intermittent. It is chronic and cumulative. The official response now feels dangerously inadequate. A lawsuit filed in September 2023 by a coalition of environmental groups including Earth Justice and Utah Physicians for a Healthy Environment accuses state officials of breaching their public trust duty. The suit argues that the state has known for years what was needed to save the lake, a 30 to 50% reduction in water consumption, and has failed to take the necessary action. Instead, the response has been incremental. The state is exploring projects like recovering water from the Newfoundland Evaporation Basin, a plan that might yield 20,000 to 50,000 acre-feet of water annually, a useful amount, but a fraction of the 800,000 acre-feet deficit the lake faces every year. It's a bandage on a gaping wound. The warnings have been clear for years. In January 2023, Dr. Benjamin Abbott led a coalition of scientists in releasing an emergency briefing. They warned, in no uncertain terms, that the lake faced total ecosystem collapse and could disappear in as little as 5 years without massive, immediate intervention. We're staring down the barrel of the biggest public health crisis our state has ever seen, Abbott declared. Now, with the confirmation that toxins are entering the food supply, that crisis has a new, terrifying dimension. Okay, I know. This is the second time I'm asking. But it really is important. A huge percentage of the people who watch our documentaries to the end are not subscribed. Subscribing is the single best way to ensure you see our next investigation, and it tells the platform that these stories matter. If you've made it this far, please just take a second and click subscribe. It's painless, I promise. So what happens now? The scientific community has done its job. They have identified the problem, measured its scale, tracked its consequences, and mapped its trajectory. They have provided the data, the models, and the warnings. The problem is no longer scientific. It is political. Saving the Great Salt Lake means fundamentally re-engineering Utah's relationship with water. It means confronting the agricultural interests that consume the vast majority of the water. It means challenging the ideology of unrestrained growth in a desert. It requires telling people they cannot have the green lawns and unlimited water they have grown accustomed to. These are politically difficult, deeply unpopular positions. But the alternative is what we are seeing now: a slow-motion environmental catastrophe, a public health disaster unfolding in real time. A beautiful, iconic, and ecologically critical landscape turning into a toxic wasteland, poisoning the air, the water, and now, the food of millions of people. The engineering to track the toxins exists. The science to understand the danger exists. The legal frameworks to enforce change exist. The only thing missing is the collective will to use them. The story of the Great Salt Lake is no longer just a local news item from Utah. It is a case study for the entire American West, a region grappling with a future defined by less water. It is a story about choices. The choices we made a century ago, when we drew lines on a map and allocated more water than a river ever had. And the choices we are making today, as we watch a city of millions breathe in the consequences. The final question is the simplest one. How much poison in the air is acceptable? How much arsenic in our food are we willing to tolerate before we finally decide to act? The lake is waiting for an answer. The dust keeps blowing. And somewhere in a Salt Lake City backyard, a tomato plant is quietly drawing poison from the soil. Its red fruit a